Hello everyone, welcome to my channel where we discuss complex medical problems related to pediatric GI and liver disorders for caregivers and parents. I am Dr. Vibhor Borkar, practicing pediatric gastroenterologist, hepatologist and liver transplant physician in Mumbai. Today we are going to touch a very crucial topic, which is understanding liver diseases in children. What are the different liver diseases in children, how they occur, what is the treatment, how they are investigated, and later on let's see what are the different types of causes which can basically cause a liver diseases in children. If I consider a liver disease in adult, I can actually count in my tip of the fingers. But when it comes to the children, there are a vast majority of the causes. In neonates, when there is a liver disease, the causes can go up to more than 120 causes. So it is practically impossible by seeing a child and actually diagnosing a disease. Let's see what can be the causes. Like they can be simple infections like hepatitis A, hepatitis E, CMV virus, EBV virus. There can be a metabolic liver diseases like Wilson disease, tyrosinemia. There can be autoimmune liver diseases where your body's own immunity is damaging your liver. There can be cancers in the liver like hepatoblastoma or hepatocellular carcinomas in the children. Along with that, there are many diseases where cause is actually not known, but still the disease occurs. Metabolic liver diseases we have already discussed, but there are certain rare diseases also. Along with that, sometimes there are diseases which affects the blood vessels of the liver like extrahepatic portal vein obstruction. Now let's see how these diseases are seen या फिर देखते हैं कि इनके लक्षणें क्या होती है. Most common सिम्टम होता है जॉन्डिस और पीलिया, हिंदी में, मराठी में जिसका कावीळ म्हणतात या गुजराती में कमणो बोलते हैं. ठीक है, तो ये मोस्ट कॉमन कारण होता है. अदर सिम्टम्स आर लाइक इफ अ चाइल्ड इज नॉट प्लेइंग वेल, ही हैज इंक्रीज इरिटेबिलिटी. पहले ठीक था लेकिन अभी चिड़चिड़ा हो गया है, पेट फूलना, पानी जमना, पैरों पे सूजन आना, यूरिन का कलर पीला होना. जो छोटे बच्चे होते हैं उसमें अगर सफेद पॉटी हो जाती है, व्हाइट पॉटी, क्ले कलर्ड पॉटी, चिट्टी टट्टी, ये जब हो जाता है तो ये एक सीरियस लिवर बीमारी का अंदेशा करता है. तो यू हैव टू बी वेरी केयरफुल व्हेन यू सी द सिम्टम्स एंड सी योर डॉक्टर. नाउ व्हाट हैपेंस व्हेन यू गो टू योर डॉक्टर? एज आई सेड, द कॉजेस आर मैनी. वी हैव टू इन्वेस्टिगेट. देयर इज नो अदर वे. द ब्लड टेस्ट कैन बी डन. दिस ब्लड टेस्ट आर कॉल्ड एज LFT और liver function test. After that, your doctor may ask for ultrasound or sonography of the abdomen, which includes liver, spleen, the blood vessels which connect to the liver, what are the sizes of this organ. All these things are carefully seen. If required, certain tests like CT scan of the abdomen or MRI of the abdomen or even the MRCP, which is a specialized MRI which focuses for the liver and the pancreatic diseases, can be ordered. And sometimes liver biopsy is done. In liver biopsy, a small piece of liver is taken and is seen under the microscope, and we try to figure out what disease is causing the problem. Now let's see how these things are treated. We are seeing that there are a lot many of diseases, so the treatment is going to vary. Understand one thing, there is no universal medicine which will treat the liver disease. We have to find out the cause and we have to tailor-made our treatment accordingly. There is no medication will decrease the jaundice, or there is no medication which can be given blanketly across to all the liver. You have to be careful what you are treating. Any medicine which goes inside the body, it comes out from either the liver or the kidney. If you give an unnecessary medication, it may damage your liver and kidney. So be careful, don't use unnecessary medicine. Now coming back to the treatment. So certain liver diseases do have a medication, like infections like hepatitis B, autoimmune liver diseases, hepatitis C, Wilson disease, they can be well controlled or treated with the medication. Then nutrition. In the liver disease, it's an important organ for the metabolism. So they do need a supportive care, which is very, very important. Apart from that, surprisingly, it is very interesting that many diseases can be just managed by your dietary interventions. Like galactosemia, you have to stop milk, or hereditary fructose intolerance, you have to stop the sweet food items. So there are many such diseases. Apart from that, the certain diseases will need a surgery, like biliary atresia, where the bile ducts are not formed at all, or colorectal cysts where the bile ducts are weak. In this kind of cases, a surgical treatment can be helpful. And there are certain diseases where there is no treatment. With the time it does progress. So these kind of diseases do need a liver transplant. And nowadays, with the advanced technology available, liver transplant has a good 90 to 95% survival at 1 year, and long-term survival can be good as 85 to 90%. We know that many liver diseases, they slowly progress, so that at the presentation the child's condition may not be that bad, but you have to consider that this child who is 4 years, 5 years, he has to live 60 to 70 years. So we have to think accordingly. We have to plan for next many decades. So when these diseases are slowly progressing, we have to keep them in a follow-up. We might have to do the liver function test quite maybe after an interval of 2 months, 3 months to see how the liver disease is progressing. For the diseases which are rapidly progressing, like an acute liver failure, they need an ICU care, ICU management and stabilization. Few of them can recover on their own. Few of them do need a liver transplant. And all the liver diseases, we should follow till your liver function test becomes normal. We have to document complete recovery. So thanks for watching my video. Don't forget to like and subscribe my channel. For any question, please post comment. Thank you.